Hello, my name is Maya Block, and I'm a Master's of Public Health student at the Mellon Enid Zuckerman College of Public Health, or otherwise known as MESCOF. And this is my internship presentation titled COVID-19 and Seasonal Influenza Vaccination Attitudes in Pima County, Arizona. Here is a little background on how my project evolved from seasonal influenza to flu and COVID-19 vaccine hesitancy. Since the spring of 2020, I've been working on my MPH internship with Dr. Purnima Medivanan on conducting research on seasonal influenza and COVID-19 vaccination attitudes among Pima County residents. The research's purpose was initially to revise a study which was conducted by one MESCOF MPH student during the 2016-2017 season of influenza in Pima County to assess attitudes and beliefs of Pima County residents about the seasonal influenza vaccine. The purpose of the survey was to identify, describe, and assess the phenomenon of vaccine hesitancy and non-vaccination among Pima County Health Department, or PCHD adult clientele. In a pilot survey, they collected 56 surveys from adult English or Spanish-speaking residents, clients in the PCHD waiting room. They discovered that 38% of participants did not want to get a seasonal influenza vaccine. Primary reasons for wanting to receive the vaccine included to avoid getting the flu, 26%, their children's interest, 18.3%, and that it was required for school or work, 18.3%. Barriers to receiving the vaccination included not having enough time, 26.7%, not having insurance, 17.8%, and not knowing where to go, 15.6%. The response, other reasons, was endorsed by 21.7% of those wanting to get the flu vaccine and 15.6% of those not wanting to receive a vaccine. This indicates that a more specific research was needed to complete the picture of why adults do and do not get vaccinated in Tucson. This project is a MESCOF and PCHD collaboration. The initial objective of the project was to assess reasons of non-vaccination against seasonal influenza in Pima County. The COVID-19 pandemic led to additional COVID-19 questions. Finally, the ultimate goal, which the three people on the left and I came up with, was to adapt a survey which would determine changes in the community attitudes regarding intention to vaccinate against seasonal influenza and willingness to vaccinate with the potential future COVID-19 vaccines. The next section covers our methodology. The overall vision of the project is composed of 6 phases: recruitment and development of a scoping review, the exploratory qualitative research phase of focus group discussions, which will be discussed in this presentation, the adaptation and implementation of a pilot survey, an explanatory qualitative research phase of interviews, and the release of a final refined survey, which the Pima County Health Department would continue to use year after year. Between September and November 2020, 11 focus group discussions were conducted in English and Spanish. The discussions were stratified by race and ethnicity, Latinx, African American, and white, and by gender. The focus group discussions were conducted virtually on a Zoom platform, which were then transcribed. Scenarios were provided to prompt responses based off of social scenarios. Categories of questions included vaccine past behavior, general vaccine attitudes and knowledge, information seeking, and beliefs about credible sources of information, social norms, risk perception, disease severity, knowledge, vaccine confidence, and politics. Here's an example of the recruitment survey we used to gather information of people interested in participating in the focus groups. We promoted our project on social media as well as through flyers distributed virtually. The social media platforms which we used were Facebook and Instagram. Finally, here are some of the findings of our initial findings from the focus groups. 6 preliminary themes were identified from focus group discussions. First, there was generally a high risk perception of COVID-19 infection. Second, perceived severity of COVID-19 illness varied by age. There were mixed reported influenza vaccine uptake for previous years, perhaps associated with age. Most participants did not want to be among the first to take a COVID-19 vaccine. Politicization of the vaccine production seemed to lead to a lack of trust in COVID-19 vaccines. Finally, young African American men appeared to be the most skeptical about COVID-19 vaccination. In conclusion, findings from this qualitative analysis suggest that risk perceptions of COVID-19 may drive higher rates of influenza vaccination. Most participants were distrusting about future COVID-19 vaccines and prefer to wait as they did not want to vaccinate immediately. Upcoming phases in our research group include the scoping review, pilot survey, explanatory interviews, dissemination of the final survey, and findings to the public. Finally, I would like to thank everyone who helped me through this project. There are so many to list, so I hope you take the time to read through. Most especially, I would like to thank the Western Region Public Health Training Center for their support in making it possible for me to pursue this internship. Thank you very much. Here are my references.